बोला हमने क्या करके वो वाले विंडो पे जाने का
म्यूट कर लो साहब आप।
सर एक ओके सर लाइव हो गया काटने वाले
आप म्यूट कर लो। मैडम फर्स्ट ऑफ ऑल गुड इवनिंग। Presently more than 253 doctors available in this webinar. First of all, a very good evening to all doctors. Thank you so much joining for us for this webinar. Topic: novel 3-dose G protein vaccine ARV. Especially thanks for our speaker Mrs. प्रियंका शाही और फ्रॉम छपरा। आप लोगों के बीच में सारे डॉक्टर्स जो है आरा, बक्सर और छपरा के ही हमारे डॉक्टर्स हैं। और उस हमारी प्रियंका मैडम जो है छपरा से एक गायनेकोलॉजिस्ट है, टॉप गायनेकोलॉजिस्ट हैं। आज हम लोग भी अपना एक्सपीरियंस और हम लोग का एक स्पीकर गेस्ट में है एंटी रैबिस वैक्सीन, कैडिला फर्स्ट टाइम इन द वर्ल्ड 3-dose एंटी रैबिस वैक्सीन। तो वेलकम टू ऑल डेलीगेट्स this webinar. Madam,
yes,
welcome.
Thank you so much. Thank you, Sanjeev ji. Thank you, Cadila, and welcome everyone on the board. So I think so we should start with the topic. No?
Yes.
Okay, I'll just stop my video because there is some net issue. So I'm just stopping and I'll just start my screen sharing.
Yeah, sure.
Okay. Sure. So hope I'm audible to everyone. I'm gynecologist by profession, but as this was offered to me that something, if we are talking about rabies, everyone from every profession should know about what is latest and how we have changed with time the vaccine schedule, which was used earlier and which present that Cadila has introduced. This is the novel 3-dose G protein vaccine. And why this is important to know, what are the good points about this vaccine. So let's start. Okay, so globally 59,000 human deaths annually that is reported in India. This is the highest. And India has got 20,000 human deaths per year from rabies, accounting for 60% of the rabies death in Asia and 35% globally. 91% death in India occurs in rural areas. And this is estimated that the rabies deaths were not evenly distributed throughout the country. 1/3 of all rabies deaths were found in Uttar Pradesh, that was 4,300, and nearly 3/4, that is 8,900, were in central and southeastern part, that is Chhattisgarh, Uttar Pradesh, Odisha, Andhra Pradesh, Bihar, Assam, and Madhya Pradesh. And among this, highest is Uttar Pradesh, Chhattisgarh, and Odisha. There are no cases of rabies death were reported in states of Kerala, Jammu Kashmir, Jharkhand, Manipur, Meghalaya, Nagaland, Sikkim, Mizoram. So together, these states represents approximately 7% of the 7% of India's population. So this is important that which part of India is actually very high on the rate of this rabies death. That is, every 9 minutes a person dies from rabies. So this is very challenging and it's very important for everyone to know. What is the current management that we are doing? The current management, which we know everyone from the doctor to the private practitioners to the registered medical practitioner, everyone know that once there is a bite from a dog or a monkey or a cat bite, the first thing what is done is wash immediately. And this wash should be for 15 minutes with soap, water, and disinfectants. The local wound treatment is first aid, that is the washing, cleaning, and then the active immunization, that is the vaccine. And if required, the passive immunization, that is the immunoglobulins. So there, which was used was 5 doses of intramuscular resin was used. These doses were as 1 IM dose of vaccine on day 0, 3, 7, 14, and 21, which we were knowing. And in the category 2 or 3 exposure on toileting with, along with in category 3, even the immunoglobulin was added. So this was important as the first exposure prophylaxis is immediate treatment. Immediate treatment should be that the wound should be properly washed. And local, the bite, whichever the scratch or bite is there, that should be cleaned properly. This should at least be of 15 minutes duration. That is very important. If it is required, the administration of immunoglobulin is very important. And starting the treatment as soon as possible after the exposure of rabies virus is very effective because this prevents mainly the death from rabies. Extensive washing means this first aid measures includes the immediate and thorough flushing and washing the wound for a minimum of 15 minutes with soap, water, detergent, iodine, and other substance that remove and kill the rabies virus. So what are the current challenges of post-exposure prophylaxis? The current challenge is non-compliance. The current rabies vaccine are the cell culture vaccine, and inactivated vaccines are of more than 50 years old technology. That is the inconsistency, then stability, availability of the drug, and even the adverse effect. So these compliance, they are categorized in 3 groups. These compliance can be categorized as the compliant group or the delayed compliant or the dropout or non-compliant. The compliant is who received the full course of anti-rabies vaccine, and that is the scheduled dose of anti-rabies vaccine on the recommended dates which were given. The delayed compliant are who completed the scheduled dose of anti-rabies vaccine within 60 days, but deviated from the scheduled regimen. That is either 1 or 2, they have dropped their doses. The dropout are who had taken at least 1 dose of anti-rabies vaccine after animal bite, but they had not completed all the scheduled doses. So now the rabies post-exposure prophylaxis in routine practice in view of the new Centers for Disease Control and Prevention and World Health Organization, there was a retrospective analysis done at travel clinic. A total of 110 patients who received rabies 4 doses post-exposure prophylaxis, and shortcoming in the management of these patients were late initiation of rabies post-exposure prophylaxis in the travelers, the administration of immunoglobulin, and antibody level, which was measured, was less than 0.5 IU per ml in 6 of 90 patients. That was 6.7% after 4 doses of vaccine. So this was a study which was conducted in 110 patients, but they were the traveler patients. This study was conducted in Switzerland between January 2005 and August 2011. And what they found that a few patients who had to travel, they received their post-exposure prophylaxis very late. Even some patients missed their immunoglobulins. And the conclusion was that the patient do not always receive optimal rabies post-exposure prophylaxis under real-time conditions. A significant proportion of patients did not develop adequate antibody level, which we could see that in 6.7% patient in the total. And these data indicate that the measurement of antibody level on day 21 of post-exposure prophylaxis regimen is useful in order to verify an adequate immune response. So once this antibody level was seen, we could see that even there were few patients who could not develop the antibody after even the receiving of the post-exposure prophylaxis. So few study was also done. Few study was done on this non-compliance to 5 doses. As with the 5 doses, it's a long regimen, and so there are so many dropouts of the patient with the proper dosing. So they had taken these 3 patients. The reason of death may be due to lack of administration of rabies immunoglobulin or poor compliance in the vaccine. In the first case, a 58-year female, we can see there was a street dog killed soon. 3 doses purified chick embryo cell vaccine she had received, with no immunoglobulin. She did not receive. And the dog bite was of category 3. And the total CSF finding, that was the cell, was monomorphs were 100%. And this diagnosis they had made of rabies encephalitis. And confirmatory test was rising serum of CSF virus, neutralizing antibody titer. Then again, the MRI finding was bilateral brainstem, mild hyperrhinositis without an restriction diffusion. And the treatment was modified milk protocol from day 1. Outcome was that the hospital survival of 16 days, but died after 1 day due to NAMA. This patient went on NAMA. The second patient, 38-year male, again here 3 doses only the patient had received. Again, the CSF finding there, they are showing that the patient went on NAMA. And even the third patient. So it was all these 3 patients. It was found that because of this long protocol, what we could see, there was drop in the management, and the patient could not get the proper management at time, or they had left the treatment in between. And they had not received the immunoglobulin in category 3. Another study, which was done at Safdarjung Hospital, New Delhi, with 360 patients who had animal bite, a pre-designed, pre-tested structured questionnaire was administered by the interview technique. And what they had found, that the compliant patients were 48%, the delayed compliant were 46%, and non-compliant were 46%. The compliance to post-exposure prophylaxis among animal bite patient, what actually we mean out here, we already knew about the compliant, the non-compliant, and delayed compliant. This was that who had completed the whole immunization. The other were who had received within 60 days of exposure, and the other were who just received 1 dose and they had dropped their immunization in between. So the conclusion was that out of 360 study participants, 131 had washed the wound using soap and water. That was for the time duration which is mentioned is 15 minutes. That was less than 5 minutes they had washed. So first precaution was not taken properly. The compliance to full course, that we could see, that was the compliance was seen in only 48% of patients. So the remaining almost more than 50% patient came under the delayed and non-compliant. So this all drawback we are seeing because of all the long protocols. Another study which was conducted at Municipal Corporation Hospital, Bangalore, and 215 animal bite patients were included. 1 dose of rabies vaccine was administered IM on day 0, 3, 7, 14, and 28 as the protocol of post-exposure prophylaxis, and also measures constant for compliance to complete the course. So what we could see on day 0, we can see that the 100 patients, they had received, means the whole, the 215 patients who were included, 100% we could see. On day 3, when there was the second dose of this rabies vaccine, only 88% were who went to receive their dose. On day 7, 85, and gradually it decreased to 60% on day 28. So in between, with this long course, within a month, so many people had already dropped out. More than like 40% of the patient, they dropped their post-exposure prophylaxis. They did not complete. And the compliance rate for intramuscular rabies vaccine was only 60%. So what are the constraints for compliance to complete the course of anti-rabies? We could see the loss of wedges, 47%. They don't want to leave their work and go, or there was some like interferes with their school timing. The kids, they don't want to leave their school for their immunization, so they could not go. The distance of the hospital from home or workplace, even the cost, and forgotten dates. They just forgot given they have to take their vaccine. So major was the loss of wedges, that was 47%. What evolution, what we know actually about the vaccine? The development of rabies vaccine, we all know that it was considered through 4 chronological stages. That was the neural tissue vaccine, the non-neural vaccine, the cell culture-based vaccine, and then the recombinant DNA and protein-based vaccine. The first, which was live accentuated vaccine in 1885, this was non-sterile, standardized dried preparation, and up to it was 31 injections of increasing immunogenicity. The second, which was introduced in 1911, this was inactive vaccine, and this minimal neural content with liquid preparation, the 14 injection each of 0.5 ml daily was given. The third came, that was the cell culture inactive vaccine, and the sterilized immunogenicity lyophilized 5 injection protocol was there. And then came the fourth generation of rabies vaccine was developed based on the recombinant DNA technology, where either the DNA vaccine or the protein subunit vaccine were developed. And this rabies vaccine consists of 5 genes, that is the nucleoprotein, the phosphoprotein, the matrix protein, and the glycoprotein, which we are right now talking about, the G protein, and the viral RNA polymerase. Among these proteins, the G and N protein are known to be important for immunogenicity against rabies virus. Most approaches are explored since DNA recombinant technology became available to express the immunogenic recombinant rabies vaccine glycoprotein. Unfortunately, in human, DNA vaccines were found to be poorly immunogenic. So we now welcome the unmet medical needs, that is introduction of the novel vaccine, our G protein, with simple and shorter regimen. Why this is important, what is good about it, why it is known as novel 3-dose recombinant rabies G protein, and what benefit we will be getting. First, this is a protein subunit vaccine. This is prepared by a VLP platform technology. And this is the first vaccine with 3 doses intramuscular, that is 037. That is within week, the dose schedule will be completed. That is, there is better compliance due to easy to flow regimen and less visits, as there was in the 31-day or 14-day or that 5 doses. That was a very long protocol. So it has come to shorter with this 3 doses schedule. This will be convenient. This is a ready to use. There is no reconstitution needed. And this recombinant rabies G protein is world's first 3-dose intramuscular resin rabies vaccine. This is a subunit vaccine prepared using virus-like particle, that is known as VLP platform technology, and where nanoparticles can be engineered to initiate differentiate immune response, which can increase the vaccine efficacy. This is a ready-to-use vaccine, which we have already told, and currently which we were using the 5-dose regimen, which was 0, 3, 7, 14, and 28. That was recommended for post-exposure vaccine. So instead of that, now this 3-dose is going to be very convenient. And this may help to improve compliance toward full course of immunization. No dropout will be there due to the unique, within a week, we are going to complete the immunization. So how does this VLP technology actually work? This recent advances in vaccine development has led to ability of newer, more cost-effective vaccine that requires fewer doses. And this breakthrough achievement that is done by the Cadila Pharmaceuticals and the novel 3-dose recombinant nanoparticle-based rabies G protein vaccine is with us. The vaccine is prepared by using virus-like particle technology. This virus-like particle self-assemble from this recombinant G protein, which is produced from gene cloned into buclovirus expression vectors and expressed in SF9 insect cells. The vaccine generates antibody against rabies G protein, and that leads to virus neutralization. As well as it prevents the virus attachment to the cell to confirm the protection against rabies. And the vaccine is in 50 microgram. It has to be administered through the IM route on 0, 3, and 7. So this is a clinical phase 2 trial. This clinical phase 2 trial was designed, which was taken with the 2 doses, that is 0, 3, and other was done with 0, 3, 7, with two doses are taken. One is 10 microgram, another is 50 microgram. And this consisted of 225 patients. Along with it was compared with the Rabipur, that was the 5-dose regimen. And it was seen that on day 14, 42, day 90, 180, on day 270, this 3-dose regimen, they did not show any type of changes. The seroprotection was 100%. Even on day 180, it was seen that the seroprotection was 100%. There was no anaphylactic reaction noted in phase 2 trial. And out of 225 subjects, 40 subjects reported only headache. That was the most frequent complaint. A few reported of muscle pain and tiredness and musculoskeletal disorder or nervous system disorder. This was only reported in 9% and 8% subjects. Regarding the safety and immunogenicity of this novel 3-dose recombinant nanoparticle rabies G protein vaccine administration, a stimulated post-exposure immunization, a randomized comparator control multicenter phase 3 clinical study was done. This objective was a non-inferiority novel 3-dose vaccine to be administered as stimulated post-exposure prophylaxis, and this was compared with the 5-dose WHO pre-qualified vaccine for better safety and immunogenicity, and it was found that it was safe. It was found that even in phase 3 trial, it was to evaluate the immunogenicity and safety of rabies G protein vaccine, which was administered as stimulated post-exposure immunization in healthy volunteers. And this was a randomized comparative control multi-center study. It was done in 800 subjects. The comparison was between the Rabipur, the 5-dose regimen. And what was found, the eligible subjects were randomized in 2:1 ratio for recombinant rabies G protein vaccine. The subject in recombinant rabies G protein vaccine received 3 doses of vaccine on 037, while the other received 5 doses, and there was no difference found with these 3 doses, with lesser of side effects. The adverse effects were very less with these 3 doses. The efficacy and safety, the seroprotection, seroprotection was found to be 99.24% as compared with the 5 doses regimen on day 40. On day 42, again, it was found to be 98.69 and compared with the Rabipur. And the result were consistent across different age group and genders. It was observed difference was 1.52% with the pre-specific margin of -4%. The non-inferiority of seroprotection primary end day point was day 14 and day 42. The tests are comparator and identical in seroprotection rate on both on day 14 and 42. So what was the main, as according to, regarding the efficacy and in the safety, that was it was very safe. The rabies vaccine, the 3 doses, it was safety is, there was less of adverse effect, only 9.9% as compared to the 5-dose regimen. The adverse effect was localized pain, redness, and swelling. That was also very low. That was 7.69% as compared to the 5-dose regimen. And regarding the systemic adverse effect, there was very few complaint of fever, ear pain, headache, urticaria, joint pain, and nausea. So the safety profile compared to the reference vaccine was very good. So what was the conclusion of this study? The conclusion of this study was that novel 3-dose was non-inferior to the reference vaccine. There was very less adverse effect as compared to the reference vaccine. And this novel 3-dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. And these are the awards that Cadila has received for the Pharma Innovation of the Year by the Economic Times and the Global Golden Tiger Award. And thank you. This was a short and sweet topic. I hope everyone must have enjoyed.
Madam, thank you very much for
It
giving
was very
valuable,
interesting. It was very interesting. Thank you.
काफी valuable information ARV regarding ARV, the fatal disease for in the world, ma'am.
Yeah, it was very interesting.
हाँ.
Even I enjoyed the session.
Madam, our delegates joined 286, more than 286 delegates joined.
Wow. Wow,
Ara,
very
Patna,
nice.
and Chhapra.
Very nice.
Ma'am, some question request, some questions are there, ma'am.
Yeah, if the physicians are there or if someone is very expert, kindly give me also some information. Even I got this very nice information.
मैम, हमने ये जूम जो मीटिंग जो अभी वेबिनार जो किया है,
जी जी.
अभी मैं 3 मैं लेके चल रहा हूँ. ये जो लिंक में है, एक लिंक में टेक्निकल सपोर्ट आप और मैं हूँ, ठीक ना. एक लिंक है जो जिसमें हमारे सारे डेलीगेट्स ज्वाइन किए हुए हैं, और एक लिंक है जिसमें मुझे ये क्वेश्चन आ रहे हैं. आपने देखा होगा कि मैडम ये अभी जो आपने वेबिनार किया, कोई साइड से आपको डिस्टर्बेंस नहीं हुआ?
नहीं, बिल्कुल नहीं.
तो ये एक टेक्निकल टीम ने हमें सपोर्ट किया. ये काफी डिफरेंट टाइप का ये प्लानिंग हुआ मैडम.
थैंक यू सो मच. इट वाज वेरी नाइस. इट वाज कन्वीनियंट फॉर मी आल्सो. और कुछ क्वेश्चंस हो जो हम लोग वाकई डिस्कस कर सकते हैं, सो इट विल बी वेरी गुड.
फर्स्ट क्वेश्चन फ्रॉम आरा मैम. symptoms of rabies.
Okay, what are the symptoms of
what
rabies?
Are the symptoms of rabies?
Okay, so we already know that from MBBS time we have been reading about rabies, no? Who has done this question?
आरश हैं.
Okay. We already know है ना, ये तो हम लोगों ने बहुत दिनों से बिल्कुल ही पढ़ा है कि when there is a bite of a dog or any animal, there will be some redness or there can be bleeding on the area, or the patient who will actually experience the symptom, they will have fever or headache, which we were actually talking ना. जैसे ये जो रेबीज के वैक्सीन अभी जो डेवलप किया है, ये सेम आपका जो रेबीज वायरस है उसी तरह का टेक्नोलॉजी पे किया गया है ना. सो सेम सिम्टम्स वो सब भी होंगे. दैट इज फीवर, हेडेक, एक्सेस ऑफ सलाइवेशन, मसल स्पाज्म हो सकता है, पैरालिसिस, देयर कैन बी सम मेंटल कंफ्यूजन, डिजीनेस हो सकता है. दीज आर द सिम्टम्स. नोजिया, वॉमिटिंग हो सकती है पेशेंट को.
Another question from other doctor, ma'am.
जी.
How is 3 is better than 5? Non-compliance is the big challenge in 5-dose vaccine.
वही तो बात हम लोग तब से कर रहे हैं कि जब भी अगर 5 डोज में अभी से हम लोग कॉम्प्लायंस का हम लोग 3 कैटेगरी बताए ना कि सबसे जरूरी क्या होता है, प्रॉब्लम क्या होती है. बच्चे हैं, वर्किंग है, काम करने वाला इंसान है, और क्या होता है कि हम लोग कभी कभी भूल जाते हैं कि हमारा किस दिन हमको जाना. आइदर हमको कैलेंडर मार्क करना पड़ेगा और कोई कार्ड सिस्टम होगा जिसके ऊपर हम लोग मार्क करके रखेंगे कि अच्छा मेरा इस दिन का तारीख है और इस दिन हमको जाना है. और ये 3 डोज क्या है कि 1 हफ्ते के अंदर आपका खत्म हो जा रहा है, और आपको 1 हफ्ते के अंदर आप मार्क किए और आपने अपना पूरा एक तो डोज शेड्यूल जो होता है वो कम हो गया ना. 3 दिन मतलब 1 हफ्ते में 3 आप ले रहे हैं और खत्म हो जा रहा है. 5 में आपको एक बहुत लंबा वक्त लग रहा है. आप पूरे महीने आपको ये लगता है कि हमको लेना है. आप कहीं ट्रैवल कर रहे हो, चले जाए, बीमार हो जाए, बच्चों का एग्जाम आ जाए, तो कितना ड्रॉप आउट हो रहा था ये भी हमने देखा. मोर देन 50% ड्रॉप आउट हो रहा था. सो नो डाउट दिस इज वेरी गुड कि बहुत ही छोटा सा ये रेजिमेंट हो गया है.
अभी 2 मेजर क्वेश्चन थे सारे डॉक्टर. मैं देख रहा था ये रिपीट क्वेश्चन यही आ रहे थे मैडम, है ना. थैंक यू सो वेरी मच मैम फॉर योर गिविंग अवेलेबल टाइम फॉर कैटलॉग फार्मा.
थैंक यू सो मच. और बहुत लोगों को तो मैंने बहुत ही सिंपल सारे चीजों को बताया कि ड्रॉप आउट सबसे बड़ा प्रॉब्लम था, और जो ये 3 डोज है दिस इज वेरी गुड, क्योंकि अब और हम लोगों को इन्फॉर्मेशन मिली ना, बीइंग लाइक गायनी, और हम लोग ऐसे प्रैक्टिस में हो, तो एक बहुत ही इंपॉर्टेंट बात संजीव जी ने बताई थी मुझे कि मैम आप लोग हर किसी को रोज कोई भी पेशेंट मिल सकता है. सो एवरीवन शुड नो अबाउट एवरी स्मॉल थिंग्स. सो दिस इज वेरी इंफॉर्मेटिव कि अभी हमारे पास ये 3 डोज वैक्सीन आ चुका है एंड वी कैन यूज इट एवरीवन. और हाँ, सबसे अच्छी बात है कि वी डोंट हैव टू मिक्स इट, द पाउडर एंड द लिक्विड फॉर्म, दैट वी डोंट हैव टू मिक्स. इट्स ऑलरेडी लाइक प्री-फिल्ड. So that is the good thing, ना? So easily आप जैसे बाकी injections देते हैं IM, you can give this also.
Ready to use.
Yeah, ready to use.
Ready to use.
Yes,
ठीक।
so it's convenient.
एक क्वेश्चन मेरा रहेगा मैडम आपसे
जी संजीव।
कि मैडम ये अभी थैविस को जो मैंने लॉन्च जब किया था उस समय भी मैं बात किया था और आपसे आज वेबिनार किया मैडम, आप ये थैविस में आपका कॉन्फिडेंस और क्या हुआ आज को वेबिनार को करने के बाद में?
मतलब मैंने इतने अच्छे से इसको पढ़ा है तो ये कितनी अच्छी बात है कि हम लोग अपने आप को रोज ब्रश अप करें। एवरी डे वी शुड लाइक बी अ स्टूडेंट। जब आप स्टूडेंट रहते हो रोज आपको सीखने को मिलता है। तो द बेस्ट थिंग इज कि हम लोगों को हमेशा सीखना चाहिए, जो नई चीज आए उसके बारे में पढ़ना चाहिए और बिल्कुल आपको कुछ ना कुछ मिलता है।
मैंने देखा मैडम कि आप स्लाइड के अलावा बहुत सारे कंटेंट ने आपने प्रिपरेशन किया था।
I was reading actually about this.
हमने देखा मैडम स्लाइड के अलावा आपने प्रिपरेशन किया, काफी अच्छा लगा मैडम। थैंक यू वेरी मच मैम टीना। नंबर्स कंटिन्यू काफी अच्छे रहे और आपका टाइमिंग इतना अवेलेबल टाइम, थैंक यू वेरी मच मैम।
Thank you so much.
Thank
you to the team also. Thank you so much.
Thank you.
Thank you.
मैम लॉग आउट हो जाइए।
Okay, sure.
ओके मैम।